Hello guys, on my last video I talked extensively on how you would know you have diabetes. I mean the signs and symptoms of diabetes. So after telling you guys how you would know, today I want to tell or teach you guys how you should be able to make use of your blood sugar machine to check your blood sugar correctly for those of us that are diabetic, or even when you are not diabetic, you just want to know on a regular basis what your blood sugar is. You need the blood sugar machine. So today's video is going to be talking about how you make use of the machine accurately, how we can correctly check our blood sugar using the blood glucose apparatus. Yes, this video is for those of us that have personal blood glucose machine and we don't know how to check our blood sugar correctly. So I'm going to be teaching you guys how we should check our blood sugar correctly using the blood sugar machine. For a nursing student who owns a personal blood sugar machine and you want to check your patients and you don't know how to correctly use it, then you watch the video. Also for a patient that owns a blood sugar machine that wants to be checking their blood sugar from time to time and you don't know how to do it, then this video is for you. So just sit down, relax and keep watching. Welcome back to my channel. I'm your favorite nurse midwife, Toju Okoro. The name of my channel is Toju Talks Nursing. On this channel I talk about health tips, nursing, finance and a little bit of vlogs. So guys, if you want to keep getting more information about health tips and nursing, please subscribe to my channel, like my videos, share my videos and comment on my videos. I'm a nurse YouTuber based here in Warri, Delta State, Nigeria. So guys, I'm going to be talking about and teaching you guys how we should use our blood glucose apparatus correctly and how to also check our blood sugar correctly. So first and foremost, I want to tell you the actual blood sugar machine I'll be using is AccuCheck Active. This machine is very common in Nigeria and in Africa. This is what we use here in Nigeria and it's very reliable. In fact, amongst all other blood sugar apparatus, this is, by my opinion, the most reliable. So what we find on this in this machine are these. This comes with the machine. It's a bag, like a small purse that you keep all other accessories of the blood sugar apparatus. It contains your meter, your lancet holder, your AccuCheck strip, and your lancet as well. So this is the meter that displays and also allows you to check your blood sugar correctly, and then your AccuCheck that keeps the strip for which you use in checking, and your lancet. So first and foremost, before you start off, we also have a notebook to record our findings. Before we start, you make sure your hands are properly washed and dried, and then you get your AccuCheck strip and your machine code. You check that the both are actually accurate and tallies with the machine. Usually some machine doesn't come with a code, some do come with a code. So this my machine I'm going to be using doesn't come with a code, but for those ones that comes with a code, you must check the code on the strip to check that it tallies with that on the machine. So the code comes to the machine, you insert the code into the machine and it displays on the screen. So once it displays on the screen, you see the same number exactly on the screen as that on the AccuCheck strip container as well. If it doesn't tally, then the machine will not work or it will give inaccurate results. So for this, I don't have the code, so I don't need to bother. So this is actually much easier because you don't have to go finding which code tallies or which does not tally. So I just go straight to checking my blood sugar. And also you also make sure that your strip has not expired, so you must check the expiry date. So on this one I have here, it expires 2021 December, so it's still very okay to be used. So I then, after which I've checked, make sure that that is okay, I now carry my lancet to place the lancet into the lancet holder. So first I uncap the lancet holder cap by twisting it and bringing it out, and then you get your needle or the lancet to fix in it. When you're fixing, make sure you fix with your lancet cap, because if you remove the lancet before fixing, you may prick your hand in error in the process. So in order to avoid pricking your hand, you have to allow the cap in place, then you place into the lancet holder with the cap like this. So when it's inside properly, you uncap the cap and keep it aside. Then your needle is in place, and then you cover back. You can see that on the cap of the lancet holder are numbers 1, 2, 3, 4, and 5. So this numbering indicates or shows how intensely this needle pricks on your fingers. Because of course some skin types, in fact we have several skin types. You have the hard skin, the soft skin, the moderately hard and moderately soft. So sometimes your skin may be so soft that you don't even need to prick very much or so hard that you immediately get the blood. But for some other skin types that the skin are so hard, you have to prick with so much force so that the needle gets into your skin very well for you to extract the blood. So that's why the numbering is here. That is what this numbering is meant for. So number 5 means that the needle gets into your skin very deeply for those with hard skin. Why number 1 are meant for those with very soft skin, number 1 and number 2. But for the sake of this video, my skin is hard, so I'm going to be using number 5. So sometimes I use number 4 for my skin because I have a little bit of hard skin. So for the sake of this video, I'm going to be using number 5 so I don't get to prick myself twice. So that is why you must make sure that you place the number correctly so that you don't go pricking your patient more than once, making them very uncomfortable. So after inserting the cover like this, you twist the cap to the accurate number. So because I'm going to be using 5, I'm going to twist it to number 5. Like you have seen, it's on number 5. So my lancet is set to be used. That I keep aside. Then I make sure I get my nails ready by kind of massaging it. Then you also apply pressure from the bottom of the fingernails to the top. Apply pressure for several seconds to increase the blood flow to the tip of your finger. So once you do this for some seconds or minutes, your fingernails is ready to be pricked. So you see the blood goes quickly so that you can easily extract the blood while you prick your fingers. Then I get my AccuCheck ready, the strip ready, and place on the machine. If you want to place on the machine, you cover immediately. If you want to place on the machine, you must make sure this 2 arrow goes face directly into the machine. You can see the 2 arrows. If you place it like this the other way around, then your machine will not give you accurate result, or most often it will not even work at all. So you must place it correctly. Once you place it correctly, it displays immediately on the screen. So it means your AccuCheck strip actually puts on the machine itself. So as soon as you place, it displays immediately. So you see, you place and make sure that it goes inside. So that arrow actually goes inside, showing only a little of its part outside. So as soon as it goes inside, you see the red light blinking, coming out. The red light comes out and start blinking. Then you see the drop of blood also showing drop blood. As soon as you see these dots of blood on your screen, then it means the machine is ready for you. So you get your lancet immediately. This has to be done very quickly. You see that there's this transparent part here on your lancet holder. You have to push this extreme inside to show this yellow display on the transparent side. As soon as this yellow display is ready, it means your needle is set and then you apply on the parts. You place like this on that part that wants to be pricked. Usually I prefer using the side of the nail rather than the nail bed, because the side of the nail actually has less nerve endings than the nail bed itself. So it's less painful than the nail bed. So I use the side. So as soon as I place on the skin like this, I press on that yellow and immediately pricks my skin. You can see the noise. So, and then you try to bring the blood out. The blood is out, and then you apply your blood to these red lights you see on the strip, and then you wait for your results. Once I'm done, I clean my fingertips. See the result immediately. Within seconds, you get your result. 118. So that is my results. So I have to make sure I record whatever results I get immediately, and then I remove my Akishek strip and discard. Also, I make sure I remove the needle and discard immediately. This needle must not be used for 2 persons. So I discard my needle safely and the Akishek strip safely and put everything back in place. And then I cover back my blood sugar apparatus and keep aside. So guys, I believe with this explanation you have understood how a blood sugar is accurately checked. So if you understand this information, please subscribe to my channel to get more information, like this video, comment on this video, and share my video. So guys, thank you guys. For you to get more video from me, you click on the notification bell as well, so that you can get first-hand information each time I upload a new video. Thank you guys.